Let's be honest, when it comes to sexual health, most of us didn't get the full story growing up. I didn't. In fact, when was the last time you had an open, judgment-free conversation about sex? I'm Dr. J. Rutland, and this is the Health Exchange. Whether you're curious about reproductive health, how different life stages affect sexual wellness, and of course, women's sexual pleasure, we've got you covered. Today's episode is about understanding your body, making informed choices, and staying ahead of the game when it comes to your health. Joining us today to answer all my questions about women's sexual health is Dr. Kendra Segura, an obstetrician gynecologist of Ask Dr. Kendra. Let's get into it. Dr. Kendra. Kendra, what do you want to be called?
Dr. Kendra.
Dr. Kendra.
Yeah, that sounds good to me.
That sounds great. We all learned it, right? So, where are you from? How did you get to where you are? What are you doing now?
So I'm from Los Angeles, and I didn't take the traditional road to medicine. So I did a lot of different things, and due to my personal health and me being diagnosed with endometriosis at 19, it's just full circle that I ended up actually as an OB-GYN because I was an epidemiologist, and it was wild how I ended up there. But long story short is that my passion is education, women's health, and really building up the community because a woman is a pillar of her family. So if we take care of her, you take care of the rest of the family. And so I am so happy to be practicing in LA, the same neighborhood that I grew up in. And also I have a concierge OB-GYN right at your fingertips, which is moi. Okay. And the reason why I started this is because it's really hard to get to know a woman in a 20-minute visit. And that's usually what they give you when you're working in a traditional sense with a hospital or with a company versus private practice where you get to kind of design how you want to spend time with the patients. And so I pretty much involve patients in their care. And so for a patient to have the power to curate her own experience, that allows them to be involved in their healthcare, feel heard, seen, and 70% of diagnoses are made by the HPI, right? Getting that history, really listening and looking at the patient because I am into the whole woman concept. So OBGYN, even though I call myself sometimes the bikini doctor, but it really is optimization of women's health. And that's my passion. And that's why I started Ask Dr. Kendra.
That's really cool. One of the questions I have for you is when I think about women's health, I'm not an expert. I know I'm not doing it right. What do you think that you're doing that you know for a fact Dr. Rutland's not doing that? Like, what is that visit like?
My husband, he's also a doctor. He's an internist,
Mhm.
palliative care, and now integrative specialist. His visits are a lot shorter than mine. I think that women respond differently to male OBGYNs versus women. And that component that I get usually that maybe my male colleague doesn't get is that, I just paid $2,000 for my car. Like, I'm really annoyed today. And yeah, you have to do an endometrial biopsy. And I'm nervous about that. But first, I got to tell you about what's going on in my life. And I have to let loose this stress. And so I feel like male doctors or male OBGYNs, they don't get that part. They just go straight to what the business at hand. So I end up spending a lot of time when I first meet a patient. And I think that that first couple of encounters when they're getting to know me and I'm getting to know them, that's where I build the trust, listening to other things that they're not here for. So it's kind of like I'm also a psychiatrist.
Hmm.
So treating pelvic conditions, a lot of the time it starts from here. So the whole woman.
When we say the term sexual health, what does that mean to you? Or what does it mean in general?
Well, sexual health is something that gets me excited because if people are having sex, generally that means that they're healthy. You have to be healthy to have desire, arousal. You have to have vitality to have an orgasm, be open to having an orgasm. So I really love talking about it, and I think it's a topic, at least for women, that is not addressed because about 43%, that's the latest statistic, of women have sexual dysfunction, but only 12% receive help or report it. So this is a topic still that people, women, girlfriends, we're not discussing enough because it still brings shame. Like, oh, something's wrong with me. My vagina is dry. What? Oh my God, am I going through perimenopause? What's happening? Why can't I sit in the chair for long periods of time, taking a road trip? Like these things I think are still embarrassing and taboo. But once you start talking about it, you realize that you're not the only one. Like this is a part of life. And through life, our sexual health is going to waver based upon medical conditions that we develop, based upon socioeconomic status. It's a multifactorial issue when it comes to sexual health.
Dr. Kendra, when
Yes.
you say sexual dysfunction, what I heard was I heard a lot of symptoms like vaginal dryness. I heard maybe lack of arousal, lack of desire. What else represents sexual dysfunction?
So there are three types of sexual dysfunction. So first, we got to start off with arousal. So sometimes it's hard for women and men to get aroused. So decreased libido. And second, we're dealing with the issue of having an orgasm, right? The pinnacle of that connection, that soul to soul connection. And I always say the G spot is in your mind. And so 30% of women never have orgasms via penile penetration. And the third thing is the penetration factor. So we have arousal dysfunction, we have orgasmic dysfunction, and we have penetration dysfunction. So those are three broad types of sexual dysfunction.
You said 1 out of 3 women don't have an orgasm during sex.
Yes.
Why do you think that is?
I think sex is complex because you're dealing with the mind and you're dealing with an individual that is either inspiring you, or perhaps you're having some relationship dynamic issues, or maybe you're just going through your own mental or health issues. And so it really requires trust to let yourself go and reach that point. And it's something that involves another partner. So usually I tell women to get to know their own bodies.
Yeah.
Using vaginal dilators, using a masturbation is healthy, really getting to know what you want so you can let your partner know. And a lot of women still aren't comfortable with what's down there. Something's down there. They know to apologize when they come see me in the office. They're just not comfortable with what's down there. Also, I encourage women to masturbate. It's healthy and it allows you to know your own body because how can you give instructions to somebody else if you don't know the roadmap down there? And a lot of women just, when they come to me, they're always apologizing because they don't know what's down there. They don't want to look. They want me to look, but they're apologizing for it. And then they want me to tell them, what do I see? I always encourage, hey, take a mirror. Some people who have real anxiety when having a pelvic exam, sometimes I actually allow them to have a mirror to see what I'm doing. And it sounds ridiculous, but again, when you're dealing with gynecological issues, I'm dealing with the mental component as well. It's really a huge factor in sex.
This is super interesting to me because I feel like with the way that you're talking right now, it's actually opening up so many questions that I've had, like, probably my entire life. Because when I sit here and I think about being a physician, and then even before I was a physician, like, being a physician, like, I will show people pictures of their lungs. I will show
Right,
them,
right, right,
what's
right.
going on. This is what's happening. I'll show them pictures of the inside of their body. But, like, when I get below the waist, I stay away from it, right? I don't say, like, if a patient comes to my office, and if it's a man or a woman, it doesn't
Okay.
really matter,
Okay.
right? Because I treat them the same, pretty much. But, like, if they come to my office, and even if they were to bring up the topic of sex, so we're getting into sexual health, they're not gonna say my sexual health.
Right.
They'll start talking about their sex life. Like, I'm not lying, like, I do get a little bit uncomfortable because I don't know the type of instruction to give them. Like, I don't even say to them, "Oh, you should talk to your partner about, what you like."
But I have a
And
question for you
please,
because you're a lung doctor.
I am.
Do you need 2 lungs to have sex?
No,
You can have 1 good lung, right?
you can have
And
one
then
good lung.
alright, I just was curious. Thank you for answering my question.
I only know that from transplant patients. So transplant patients that get one lung,
Wow.
that I know are having lots of sex. There was this guy actually at the VA
Okay.
in Kansas City, sarcoidosis patient who had a lung transplant. So he only got one lung.
Is that usually?
No, now we do kind of double,
Okay,
but
okay, but
you
he got
can
1.
do one.
Okay.
He got one, and
He ran with it?
he ran. He he
Did
ran.
a
He
little bit
ran.
more than
Yeah, he
running.
ran through him. Like he was. He would always talk about it to every clinic visit. Like when I think about my own sexual health, I know like how many times a week I would like to have sex with my wife, like
Which is
4 to 5.
wow. Okay, so that's
I would like to.
pretty okay, now okay.
You didn't say how many times have I. You said I tell you like to.
Right,
Like this is Rutland's dream, right?
right,
But like it's hard because I'm traveling all the time and
right.
all that. So like I understand that. I've actually never talked to her about.
What she likes?
Yeah, I feel like I know because we've been together for 17, 18 years. Like I feel like I know what she likes and I get the body language.
Mm.
But actually talking about it, which is funny because I'm a talker, right? I
Right,
love
right,
to talk
right,
about things,
right.
but I do not talk about that. And you could tell my producer, said to you earlier, I want you to get him nervous. Like he can't talk about that. Like I'm not nervous about talking about it. And I've read about it and I
Right,
can
right,
understand the hormone differences. And, I understand that the more testosterone you have, the more you're going to want to have sex.
right.
I understand, pleasure and dopamine. I understand all of that. I get all of that. But you know what's funny is we prescribe all these medications that affect some of these hormone levels. But I can tell you, like, it's not common for me to ask about somebody's sex drive or sexual health. And I just feel like I'm doing it wrong.
There's another language that you and your wife are speaking, and that's that body language. That's that, you know, paying attention to detail, how she moves when you touch her. Couples who are in sync and have the same goal, which is, I want to share this experience with you. I want to show you my love physically. You have been collecting data on her, and it's just all subconsciously. So there's different ways to find out what your partner likes. But for people having issues, I encourage them to get to know themselves to help the partner. Just like I always tell patients, help me help you. If you're coming to me and you're saying you have pelvic pain, well, I'm going to be asking you a couple of questions. When do you get it? What type of pain is it? How often? What alleviates? What makes it worse? So you got to do the work. There's no magic pill, there's no magical cream. It just takes a person who's patient. And if you happen to have a partner, a patient couple willing to explore and improve and get to the bottom of what's going on.
There's differences between men and women in this realm. And from what I've read, which, as a man, like I could say that seems to be pretty accurate. A man is physical. They have testosterone, most of us. So you're gonna right. So you're gonna have that want to, that desire to. Estrogen kind of gives you some of that arousal as well. But one of the things that I came across while reading is, and it seems obvious to me, is women. It's not just the want to have sex; it's the connection and the mental and emotional connection with their partner.
Absolutely. But I want to make clear one misconception about men and women. Like, it's commonly known men think about sex, once every 3 minutes or 2 minutes of the day, something ridiculous.
That seems high.
But that is false. Women want to have sex just as much as men. So that's a misconception. Another misconception that a lot of men and women have is that sex, it's okay for you to hurt a woman to be in pain during sex. that is in no way true. If you are experiencing pelvic pain during intercourse, you have to go see a gynecologist. You have to get checked out. And a lot of women don't really speak up because we think it's normal. And a lot of people think it's normal. You'd be surprised. Well, supposed to just take it. No, you're not. Maybe you need to change the position. Maybe the angle of your uterus. Maybe the angle of your uterus, meaning being anteverted, mid position, or retroverted. And if your partner is has his penis is straight or versus curved, you guys heard of Peyronie's disease? Like I always think of Captain Hook. So if you're anteverted and your partner has an extreme curvature, that is not going to work, right? Retrograde uteruses work better with curved penises.
So what do you say to somebody just like, hey, your uterus, your vagina ain't gonna work with his penis. So you're gonna have to find another penis to work with. And I mean, is that like how's that conversation go?
So that conversation goes to exactly knowing your body.
Yeah.
So two partners knowing the position. So different positions benefit the man who either whatever degree of curvature he has to his penis, and usually that's caused by trauma, and the angle of her uterus. So certain positions work better. A lot of times when a patient just knows that, okay, you know what, it's okay that this position isn't my favorite because it's painful. So it's changing the position, it's informing your partner, talking to your partner. But if you think that it's normal, you'll never speak up and then you'll never reach that orgasmic level that is meant to happen when you're in love with someone and you want to just experience it in the natural, touchy form. You know what I'm saying?
I mean, I do. I mean, I think that we probably all experience that.
Right.
Yeah,
Again, back to 30% of people don't experience orgasm through penile penetration. And so it goes back to masturbation, knowing where the G spot is. And I always tell people the G spot is in your mind. So if you're not connecting mentally, the arousal can take a little bit longer. That foreplay can take a little longer. And unfortunately, we're living in a society where everything is so fast, everything is so quick. So foreplay really is non-existent. So when you go straight from kissy kissy to straight sticking it in, well, it hurts, Dr. Segura. It's dry. Well, of course, the glands aren't secreting your natural KY,
how long does that
right?
take? How long does it take for the like
Unfortunately,
on
if
average?
I knew, I wouldn't even be here. If I knew that answer, I wouldn't be here. It's different for every woman, and it depends on the circumstance, health status, and, how much time do you have? Do you have little ones running around busting through the door? So it's really variable, and that's what I said. Sexual dysfunction or sex in general is not just simply you're dry, let's lube it up, and, I'm perimenopausal, so just throw my vagina away. Like, no, no. It is working with your hormones. It's working with a physician, actually, to help you figure it out. Like I said earlier, 43% of women have sexual dysfunction, and only 12% will seek help. So that
That's
has to change.
yeah. How do you think we narrow that gap? How do you think it was by having conversations like this? Or is it
Absolutely. Platforms like this is so important. And I think especially that, I have to commend you. You are a man and you are actually interested in women's sexual health. So I always tell like all, providers, you always ask, "Hey, how's your sex life?" Because again, sexual health, if you are for lack, horny, if you are aroused, if you feel that you can just hop on it, that means you're healthy. Healthy people have sex. Healthy women have babies.
and people who have sex actually have reduced mortality rates and all
There you
that.
go.
Yeah.
There you go.
Yeah. We're having this conversation because I'm borderline selfish. I got two basically teenage girls
Yeah,
who are on YouTube watching all kinds of things
right.
and learning about their bodies, right? The budding has started,
Right. Periods.
ovulation has
Periods.
started in my 12-year-old. Yeah, yeah, yeah. When do you, and I actually asked my wife this morning before I left. I said, have you talked to Amelia about sex? Like, I actually asked her that question, which is my oldest daughter,
Okay.
and she said, "Yeah." And I was like, as a dad, I was like, part of me was like, "What you mean you talking about sex?"
Right. And
Right?
I didn't I know about
But
this.
part of me yeah, but part of me was like, "Oh, I'm glad she's talking to her about sex." But it's hard as a dad because, like, you want your daughter to be healthy, but that's
Right.
not something that I don't know, it's such a interesting conversation to get into as a father.
But as a father and as a physician,
Mm.
your approach to period health is is basically saying that after so I advise for anyone who has a daughter who started their menstrual cycle, along with, her gift of a period box, Midol, chocolates, is also a trip to the OB-GYN. And not every visit is gonna be, "Let's spread eagle, here's a speculum." No, getting to know your OB-GYN before you actually need your gynecologist or, obstetrics, there's teen pregnancy out there, it does exist. Nexplanon, Mirena, shout out. It's just a conversation about your body and how has your body changed. So I encourage parents to take their newly menstruating daughters to go see the gynecologist and have a conversation and discuss what body changes you go through and what is a normal period. And a lot of us still don't know what a normal period is. So I think that just like we take our kids to the eye doctor, to the dentist, a lot of people, especially a lot of Black and brown communities, think that you have to go to the gynecologist only if you're having sex. So a lot of kids don't even want to dare ask their dad and their mother, take me to the gynecologist. But it should already be a part of the well-being of the child. Like, okay, you started your menstrual cycle. Let's go talk to a gynecologist. You tell her your symptoms, you ask her questions. And I always have the parent leave the room after. So that child can ask me anything she wants and understands that I'm her doctor.
What's the most surprising question you got from a child in the room once the parents left?
I'm having a hard time getting pregnant.
From a child? Like somebody under 18 has asked you that question?
Yeah. And I'm just blown away and I go into
Yeah, how do you respond to that?
I go into my own personal experience. I have a son, he's 5, just ending kinder, doing very well, very hyper. But a lot of things people don't tell you or the book says different. So I start describing, I start with the body. I said, the book says your areolas are supposed to decrease and go back to normal size after pregnancy. No, they don't. Your feet get bigger. It's supposed to go back to normal size after pregnancy. Not always the case. Breastfeeding helps you lose weight, not if you have insulin resistance. Okay. So I start with the body changes of, earning your mommy stripes. And then I go into who is going to watch the baby when you have an eyelash appointment? Who's going to watch the baby when you are trying to get your wig installed? Who is going to watch this baby? And a lot of people think, including myself, which shocked me about having a child, I am married, is that even though I have a husband, a great husband, I love you, baby, I still carry the mental load of where that child is going to be. Who's going to have him? Where is he going to be? What do we need to do? After I get done, telling them my struggles, then I go into that birth control, long acting birth control. And so I just am honest with them.
Do you ask them why they want to get pregnant at that age?
I do.
And what's some of the reasons?
The core of the different answers that I get is low self-esteem.
Uh,
Really
Meaning.
trying to, help the relationship out, thinking that a baby is gonna bring you closer when anybody who's a parent knows that that first year, you know what I mean? It's just like I was happy that I have OB-GYN training. I'm used to sleeping in short cycles, getting up, laying down. I started thinking, wow, what about my 15-year-old patient who doesn't have the support of her parents? The father is out the picture because he's just a baby. And it comes mostly from beautiful women. So that is really letting me know that building self esteem in our children when they're young that is something we just have to instill that, you won the race. You have the gift of life. And simply because of that, you are worthy.
I'm so glad my kid is ugly. No, I'm kidding.
Ah!
But
But they say dads who hug their daughters prevent other little boys or men from hugging them.
perfect.
So daddies who hug and touch their daughters in that loving way, and you're beautiful and you're amazing. So I think about my dad. I'm a daddy's girl, and he was the first man that I fell in love with. He was the first man that took me out on a date for ice cream and, you know, took me out for pizza. And so that was my model, and that's been my bar ever since. And so, you know, if you're hugging your daughters, that's no space for another man.
I probably hug one more than the other. I'll work on that. Now it's time for What's the Buzz, presented by BuzzRx. Every week, I answer a health-related question from one of our viewers. This week's question: my OB-GYN suggested hormone replacement therapy for my perimenopause symptoms, but I'm nervous about trying it. What should I actually expect? This is a great question, and perimenopause is definitely a period in a woman's life that can be full of misinformation or lack of information. As a woman ages, estrogen levels decrease. This is the direct cause of perimenopause and, quite frankly, menopause. Hormone replacement therapy, or HRT, can be effective treatment for perimenopause and menopause symptoms like hot flashes, night sweats, mood changes, and vaginal dryness. There are medications like estradiol and progesterone which patients can take to treat. The goal of HRT is to restore female hormone levels, and it's totally understandable that you feel nervous about starting it. But the age you begin HRT is what matters. It is recommended to start HRT before the age of 60 or 10 years before menopause. That's the buzz. If you have a question, email us at healthexchangepodcast@gmail.com. Please understand that you can go to buzzrx.com or, quite frankly, download the app by BuzzRx to be able to get your medications at a reduced cost. One of the things that I think has been extraordinarily helpful about having that sexual health conversation, I think, with children is the development of certain vaccines in females, right? So when you look at sexually transmitted infections, and probably most people out there probably don't know this, but the most common sexually transmitted infection worldwide is
Yes,
right?
exactly.
Is HPV. And one of the biggest consequences of HPV is cervical cancer.
That's right.
And they say that HPV causes 5% of the cancers worldwide, which is crazy to think about, right? Because
Right.
you got this DNA virus that is infecting the epithelial layer down there. And because of its presence, it leads to a significant cellular change that can lead to cervical cancer. And we know that the way that you get HPV is by having sex.
But to this day, it still amazes me that a lot of women don't know it's a sexually transmitted infection.
Yeah.
They don't know. They don't know that, and a lot of times they kind of want me to figure out who gave it to them. And the tricky part about it is it can lay dormant until you are immunocompromised, and via pregnancy, if you develop diabetes, any cardiovascular disease, or just stressed out.
Exactly.
You know what I mean?
Yeah.
And so in this climate, everyone's on edge. And so I just recently had a woman who was about 60 because we stopped screening for cervical cancer at age 65. And she said, I haven't had sex in 10 years, Dr. Segura. So how can you say that this is transmitted sexually? I said, well, did you ever have sex? Are you virginal? And, just to kind of let her know that we can't tell which partner gave it to you.
Right.
So that's why everyone should get vaccinated, because it's it's the number one GYN cancer that's preventable in first world countries. And I commend you for talking about the HPV vaccine, because a lot of people don't trust vaccines, but this vaccine is 50 to 65%. And as you know, in the medical community, that is a lot, because usually vaccines 20 to 30%, and we're happy with that, like the influenza. And so this is a huge number, and I really exaggerate that to the patients of, even if you have HPV, high risk HPV, it can prevent you from 50 to 65% of that high risk HPV from for your cells changing into cervical cancer.
when you talk about high risk HPV, that percentage is actually really high because when you look at the different subtypes of HPV, there's HPV 16 and 18, which cause 70% of the cancers worldwide. And the vaccine, the most common vaccine that's given, Gardasil, I
Yes.
think is the one.
Yes, it covers 9 HPVs
Subtypes. And it
subtypes.
covers 16 and 18. And so when you look actually at that data in preventing cervical cancer, it's like ridiculously good at it.
Yes.
And so we have to understand that I know it's scary for your 9-year-old, which I think is the age now.
Yes, it is.
For your 9-year-old to get vaccinated against a sexually transmitted infection. I get that it's a scary topic. Look, I'm a dad of 2 girls. It's a scary topic for me. I swear to God, it's a scary topic for me. But I think when you think about understanding that it takes 8 to 10 years for this cancer to develop over time, giving them the vaccine early when they're 9 years old, it really is going to protect your child down the line. As a father and a husband of somebody who had breast cancer, I wish that I could give my child a vaccine that would protect them from breast cancer, because I got to worry about this 10-year-old and this 12-year-old of mine for the rest of their life because their mom had breast cancer at 35 years old.
Young.
So that is, I can't say enough about promoting and encouraging that vaccine. I don't care what you have to say. Like, the science has proven that it's effective, period, end of story.
End of story. And I really, me being a mother of a son, as soon as he reaches of age,
He's getting it.
he's getting it because men harbor it. And so, that's a hard concept for women to get. Like, how did I get it? Like, how did I get cervical cancer? And unfortunately, I have diagnosed that too many times, right? A lot of women only see me for pregnancy. So I try to do as much primary care as I can, because after they deliver, you guys just forget about me. And then I see you for your next pregnancy, and what's happening with your health. Things got worse. As a mother to a male, a future king, it's my duty to protect the ladies. So I'm taking him to his pediatrician or to his family medicine physician or whoever. Just I'm taking him to get vaccinated, because we also forget that HPV can cause anal cancer, throat cancer, depending on, not too much in the US, throat cancers, but people who perform the surgeries like I do, we're at risk to getting that, because it's that, yeah, virulent. So it's all of our duties to really vaccinate our children.
Yeah, I mean, and I always tell my patients, like, especially young men and young women, I'm like, anywhere the male can stick it, you can get a cancer there.
I love it.
So, like, that's what we're protecting against. Like,
Yeah,
they like, okay, fine. If you want to protect yourself from genital cancer, it'd be great. If you want to protect yourself from mouth cancer,
Yes.
that'd be great. But protect yourself from anal cancer,
Yes.
that'd be great.
Right.
Right. I remember the first time this is a story. I'm gonna tell you a story. I remember the first time I ever talked to somebody about the HPV vaccine and preventing cancer. I was working in the ER and on an ER rotation as an internal medicine resident. And the guy came in and he clearly had a sexually transmitted infection. He had all the risk. He had an uncircumcised penis.
Okay.
He came in, he said, it's been hurting when I urinate, pull back the foreskin, and it just looks like, it actually looked like poop. Like, it looked like
snap.
poop together. And I was like, he's like, how long you been penis? He's like, I've been doing it for a while. And I was like, how'd you get this? He's like, well, I've been having anal sex with my girlfriend for the last few weeks. And I was like, this was one of my moments in medicine where I was like, you are a physician and you need to tell this kid, like, everything about sexually transmitted infections. You're talking about HPV, because the vaccine was relatively newish then.
Okay.
And I just told him, and I was just like, listen, man, I was like, I appreciate your bravery, but sometimes bravery leads to stupidity. And I was like, you got to protect yourself. First of all,
bravery for what? The anal sex?
yeah, I mean, he's being a kid. Like, I get it.
All right.
But, like, you want to wear a condom. Like, number one,
Right.
you want to wear a condom, protect yourself. Number two, when you start having symptoms like this, you need to visit a physician right away. And number three was, when you start to have sex, like, at least educate yourself on the type of sexually transmitted infections so that you can have optimal sexual health. It was like, it honestly was
I
like a
commend you for taking time to actually talk to somebody about, like, going through that because at first sound of, "Oh, you need to get the HPV vaccine," everyone's like, "No." But
yeah,
after I sit down, I break it down, and another thing that I'm always shocked about is that a lot of women don't even know what a pap smear is looking for. A lot of times they think it's uterine cancer. Or they think that we're diagnosing the cancer with the pap. I've kind of learned and I'm still learning, that what is common sense or simple to me, is not to someone else. And why would it be? This is not their area of expertise. The simple things aren't always so simple to
no,
other people. And then one misconception I think that's very important for us to kind of pause and talk about is that sexually transmitted infections, you can walk around here and not know you have one. So that's why it's important that if you are expressive with your sexuality, that it's important that you get STI screening because you know that from today's talk, it can be asymptomatic. And that is what a lot of people don't know about. A lot of women don't know that subfertility or infertility can be caused by an STI, chlamydia. And some of us are walking around here with the hot, inflamed cervix and uterus, having pelvic pain. Okay, sex is no longer fun. And once they meet Prince Charming, they're having a hard time getting pregnant. So then they'll come to the gynecologist. And then we find out you have pelvic inflammatory disease and everything's all scarred up.
right.
And they say, no one ever told me. So I always remember those patients and I tell, just like yourself, it does take a little more time, but I say, hey, you can't say that no one has ever told you. I want you, before you say no to a vaccine or to any treatment, know what you're saying no to, essentially.
I'm not an obstetrician gynecologist, but I do understand the anatomy. I do understand the ovaries, the fallopian tube, the uterus, the cervix, the vagina. I understand all of those things. And all of those things exist kind of together and they all communicate with one another. What she's talking about when she says pelvic inflammatory disease is she's talking about inflammation and or scarring of any of those organs that I just mentioned, from the ovaries through the fallopian tube down to the uterus into the cervix and then out of the vagina if you're going to have a child. And so, what's important to think about is when you have inflammation near the fallopian tube or near the ovary, or as this infection continues to stick around those epithelial cell layer, the infection gets deeper and deeper, and you recruit over more and more white blood cells. And as you recruit over more and more white blood cells, you'll start to get the transition into what we call an epithelial mesenchymal transition, and then the scarring cells start to lay down that collagen.
That blockage.
And that's what she's talking about,
Mhm.
is that egg can't get past that fallopian tube to go ahead and be fertilized where it needs to be and then stick to the uterus and make the placenta and grow up somebody that looks like us, right?
Mhm.
It's already against stupefying odds that we exist. It's 1 in 250 million people, right? So all the people that ever could exist
Right, right.
actually
So many
don't.
things can go wrong.
Right? So many things that go wrong. And if there's something like pelvic inflammatory disease, something you can do something about, or if you have an infection or you think you might have an infection, go get tested. It's really easy, right? We just do a basically DNA amplification test and we see if there's the presence of that kind of bacteria, right? Gonorrhea, chlamydia, right? Neisseria gonorrhea, Neisseria, chlamydia, trachomonas. You can also have a mycoplasma type of infection. We call it mycoplasma genitalium. It's kind of a newish type of
Mm.
sexually transmitted
Mhm,
infection.
mhm.
Herpes simplex 1 or herpes simplex 2. Now,
Ouch.
tell me about herpes simplex, right? Tell me about the herpes viruses because a lot of people, I got a lot of patients that freak out about it, right?
Right.
I don't freak out about it. I'm like, listen, like 80% of the population has the herpes virus. Like, I wouldn't
Exactly.
worry about
From daycare. Hart was in daycare, and he came home with, like, a fever blister.
it. This is your son.
It's my son.
Uh,
Hart's my son. Love you, baby. But I don't love you that much where, I'm looking at it, I'm like, "Ooh," and he's in the stage of kissing me constantly. Like,
Yeah.
he's gonna marry me, he's gonna take care of me so I don't have to work. Why do I have to work? Daddy should be the one working. I'm like, "Oh my god, we need to prescribe Valtrex." Like this, I don't need him giving me ocular
Right.
herpes. 'Cause herpes can go anywhere. But the most common areas is the mouth and the genitalia. And Back when I was training or in school, it used to be HSV herpes type 1 was the mouth and herpes type 2. But now we know they're interchangeable. It can go either way. And so the dangerous part about herpes when you're pregnant is that if you do have a lesion or maybe the prodromal symptoms are happening and you're shedding that virus, if the baby goes through the canal, the baby can get herpetic encephalitis. And it is the worst thing because we have medication to prevent that. So that's why I think it's important for you to have a relationship with your body. A lot of times, we don't know, is this supposed to be here? What is this? Go to the gynecologist. I'll tell you.
I just always tell my patients, like, stop tripping about herpes. The only time I really worry about HSV 1 or 2 is, first of all, if you see a sore in your genital area, you're more likely to shed virus and give it to your sexual partner if you're unprotected, like, especially if you're unprotected, right? And anywhere, like it could be anal, whatever, wherever it is, wherever you're sticking it, like it can happen, right? The other thing, though, is from a health standpoint, herpes is a DNA virus. Typically speaking, when you have a competent immune system, meaning an immune system that's able to respond to antigen and keep things under control, you're not tripping. But if you develop an immunodeficiency, if you develop human immunodeficiency virus, right, HIV, which is a virus that actually specifically infects T cells, helper T cells. These are T cells that communicate with B cells that make antibodies, right? So your immune system just doesn't work anymore. If you develop some type of immunodeficiency, herpes can go crazy.
It can be quite painful.
It can be quite
It's in the
painful.
neurons.
It can be in your blood. It can disseminate throughout your entire body. That's when I worry about it a lot. But I think from a genitalia standpoint, you've been told you have HSV 1 or 2, and as long as you're not showcasing any lesions, any ulcers, like you're fine. You're probably fine.
OB-GYNs, we don't test it in the blood. Unless you have a lesion, and unfortunately the culture, the PCR is only 70% sensitive to detecting it. But we got to put eyes on it, and I let the patient know that just because I'm culturing it, like, it's clinical. It has to be blistering. It has to be ulcerating. But I've also seen variants, and that's with just clinical practice, atypical, lesions that didn't really look, like the pictures.
I want to move the conversation back to sex.
Oh, sex. Okay, yeah.
Okay.
Sure.
The
Okay.
reason I want to move it back to sex is, like, of course, I'm a man. I'm always excited about having sex with my spouse, right? But I also, as I think about sex from an aspect of adolescent to mini adulthood to adulthood, late adulthood, how do your hormones change, and how does that contribute to the way that you feel about sex? Like, what's the evolution of that over time?
So the evolution is estrogen. Estrogen does so many things. I know we know if you're having hot flashes, it's very popular. Oh, you must have low estrogen. But estrogen is involved in, heart health. It prevents dementia. It helps bring back the blood supply to the mucosa. So as we age, we lose our estrogen, it drops, and so does our desire for, going back to the sexual, three different type of sexual dysfunction: arousal, orgasm, and pain with penetration. A lot of women don't realize and they don't come forward when we talk about sexual dysfunctions because some of them are young, because medications can decrease your arousal. So basically, it declines as we age. Okay. And so that is the reason why so many people, women, now that we're living longer, average age is 81, American women. And so now it's like, okay, we're living longer. Why are we getting so much? Why is dementia? What's happening? Is there a correlation? And there is. The data says that estrogen is involved with dementia in regards to the precursor being brain fog, forgetfulness. I had my own colleagues say that they would be in surgery and forget the next step
Mm.
of what to do. Something that's bread and butter. A lot of bread and butter for OB-GYNs are C-sections. And thank God the resident was there because she just totally went blank. And that is scary, number 1. But those are things that happens, that this is the evolution of maybe the precursor to being at higher risk of having dementia.
Yeah.
Estrogen decreases as we age, even when you're pregnant. Pregnancy, a lot of people ask me, I don't feel like doing it. I'm like, well, you have this big, you have this parasite in you growing and it's compressing your organs. So, if you don't feel like doing it, having sex the traditional way, there are other ways to please yourself and your partner, but it's okay to say no. And we need our partners to really support that. So go pleasure yourself. Go be independent about your own sex drive, your own arousal. And that is a good way to support your partner because the most cases of, men stepping out, for lack of a better term, is when some woman's pregnant or when a woman has chronic illness. And a lot of times relationships can't last through a cancer diagnosis. Sex can really drive you away from your partner or closer together. So it is important.
And listen, I know we're spending a lot of time talking about male and female and penetration. We understand that males will have sex with males and females will have sex with females and
Oh,
what
that's
have
right.
you.
Thank
Right.
yeah, thank you
Yeah.
for being
And
inclusive.
again, I just want to be inclusive when I say that. We're just talking, we're talking about our experiences. That's why it sounds that way. But I also want to say anywhere you're putting your mouth, your tongue, and as we're talking about these sexually transmitted infections, it's the same thing. Like it doesn't change. Now, for certain infections like HIV, you're more likely to probably obtain it if you're unprotected when you're performing intercourse anally
Right.
versus vaginally, but that's just because of the amount of lubrication that is naturally available, right? If you can imagine, if you are penetrating anally, you're ripping a lot of those cells apart. And so as you do that, you are exposing some of that tissue and those blood vessels a lot easier than in the vaginal area. So
And
those
the
are things to
and the
consider.
mucosa in the anus is thinner. So things can penetrate through. So they usually say if you have HPV, then you increase your risk of getting HIV. And so that's why it's so important to be honest about, your sexual identity to your doctor. And I really take time to ask, what is it looking like? Are you having sex with women? Are you having sex with men? And I try to ask it like just like I'm asking anything else. I don't make it a moment because I want them to feel comfortable, like this is just a regular thing. And one of the misconceptions is for female with female, they think, "Oh, I don't have to get a pap smear, Dr. Segura, because I don't have sex with men." No,
Yeah.
you still have to because there's other factors, lifestyle, such as smoking, diet, that could actually change the cells on your cervix, and we call that dysplasia. So you still need to get your pap smear, no matter who you're having sex with.
One of the questions I have for you is earlier you were talking about visiting with your patients in clinic, and you were talking about how females need to get to know you, how females need to be able to establish really more of a rapport with you.
Relationship.
Yeah. Talk to me about that. Do you like, cuz I feel like you do that better than any other doctor. I can establish a relationship with female, but like not like you're establishing that relationship in terms of what you're taking care of and who you're taking care of.
Well, my daddy says I'm nosy. So I am one of those doctors.
You haven't asked me nothing.
Usually, patients when I stand up and I go for the doorknob, that's when they're like, one more thing. So I'm kind of like Columbo in the reverse. And this is where it gets real because and of course we get upset because it's like, okay, I spent 30 minutes talking to you about, HPV, but when I really need to give you prep. And I really need to talk to you about why you're having intercourse with him without a condom. And you have lupus. You have all these other risk factors, right? So I think that because of my interest in the human experience, I truly enjoy getting to know people. I truly enjoy learning from people, and I feel blessed being in OB-GYN 'cause I feel like it's a specialty because you are vulnerable, right? You're in the stirrups, you're open, and whether you like it or not, this person who's a doctor, better be a doctor, or it could be, a healthcare professional, let's just say that, comes in and is just doing stuff to you. And this is private part. This is what we teach our children, right? No one's supposed to touch here and here. So I feel like, since it's personal, I think I should get to know the patients a little bit more.
I mean,
The personal.
it takes a special person for to say to somebody when they bring when you got a pregnant woman who brings in her spouse and the pregnant woman says like, I can't, I don't feel like having sex. And then you just look at the spouse, you're like, well, you need to play with yourself. Like you gotta go,
Oh, that's me.
like you gotta do that
That's me.
yourself. Like now go, go to the bathroom, go where you need to go, but you gotta do that yourself.
I have ruined so many relationships. I have seen men, their heart drop to their stomach.
What was one thing you said where you saw their heart drop to their stomach?
I had a pregnant patient
Yeah.
and we were happy. She had her partner, she was married, and they already had kids. And that day was a really tough day for me. Usually, when I'm tired, I'm more just brutally honest. And so my nurses usually warn you, like, hey, get ready. There was, a smell in the waiting room. Or, hey, the patient's upset. She has high anxiety. You get a heads up.
Yeah,
That
yeah.
day, I was given no heads up. So I came into the room, opened the door, and boom, got slapped in the face. Trichomonas. That stinks. And I was so upset with my nurse that she didn't warn me because I had doctors were human too.
You got the spouse and the female in there.
Yes, and they're both wearing sweats. So the airflow is not good. I come in, he's sitting like this. She's up on the bed like this, and I said, "Close your legs." They had the children there, so I had to go close to them, and I had to say, "You have trichomonas." And they said, "What's that?" I said, "It's the STI." And immediately we both look at her partner, and that's where I can just see, the temples, that vessel pumping, and he was, had a frog in his throat. And I said, you guys can deal with the relationship later, but you cannot have sex until you get treated. And it's very hard to get men to go to the doctor and get treated, but they kept giving it back to her. And I said, this leads to preterm labor, or if you're early on in the pregnancy, it can lead to miscarriage. So that's why we don't want you walking around with sexually transmitted infection. I talked to the nurses and they're like, is that what that smell was in the waiting room? I'm like, yeah, and I could have got a heads up. And so basically I made that visit shorter because I said, I just can't talk to you guys right now. It smells, you guys know why. And I'll give you the treatment. And then we can have a telephone visit if you have any further questions. And I had to open the door and it was so just potent.
Look, you guys, there are certain smells that are associated with medicine, and you can smell certain things, and you can diagnose it
I
like
could
right
smell,
away.
yes, BV,
Yeah.
trichomonas, and chlamydia. This nose right here, okay, this nose. And you know what? My smell got better after pregnancy.
Did it?
Like during pregnancy, I couldn't stand the smell of my husband, especially in the beginning. I was like, you need to wash your hair. Something is going on here. And again, this is another thing that they say once you deliver the baby, your smell should go back to normal. But no, some days I think if I had this hyper what is it, hyperosmia? What is it,
Yeah. Like I think it's when you can smell extra.
Yeah,
I think it's osmia.
yeah.
I think it's
Hyperosmia is supposed to go away, but now I can diagnose and I smell things. And some days, on my bad days, I'm like, you know what? Why am I doing this? My mother
Why
encourages
are you
me.
smelling?
Just why am I in this like field? Like, you know what I'm saying? Like, it's sometimes you feel, the smells are violent. This is the human part of me. And my mom reminds me that, women need help. That's why they're there. And they wouldn't be there if they didn't need
Do you
it.
still deliver babies?
Yes, I do.
So, as you're managing pregnant patients, I'm not testing you. I'm just going to ask you this
Sure,
question.
sure.
Do you know the most common medical diagnosis or medical condition in a pregnant patient?
Anemia?
Asthma.
Wow.
8 to 12% of pregnant females have asthma. It is the most common medical condition in pregnant.
Is that pre-existing or the development too? Does it involve
Both.
people who
It
develop?
incorporates both.
Amazing.
People who are pregnant.
I don't think that we do the best job to manage asthma in pregnancy. And so I have no problem with referring and co-managing with that. I do know for a fact that 30% of women who are asthmatic and pregnant, it can get worse.
Yeah.
With the pressure of the uterus getting bigger, pressing up against your diaphragm, and having that asthma, it can really feel like life-threatening. You're dying for breath. Yeah, asthma is just something where it can make someone, even if you're not pregnant, you can go to a panic attack
And
because you're gasping for that air. You're
and
too.
I always wanna make sure that OB-GYNs have the knowledge to manage asthma because as you said earlier, a lot of these women just are going to see you for those 9 months. They don't see really any other physician. And so having the ability to manage asthma, like I get text messages from all my OB-GYN friends like all the time.
Is it really mild intermittent?
Right? I mean, like
I
asthma's asthma. If you have it, you have it. If you got symptoms, I'm giving you more medicine, right? So it's just, and for pregnant patients, it's the same thing. Inhaled corticosteroid, short-acting beta agonist as relieving therapy, and then you're also going to use inhaled corticosteroids on a daily basis. You're going to use long-acting beta agonists on a daily basis. You're going to use those two things in combination on a daily basis. If somebody has severe symptoms of asthma, you might have to step up to therapy to certain biologics. There's really only one that's been studied extensively, but it's just something that you have to think about and manage, right? I mean, it's just something that we have to continue to manage. You don't change it when they get pregnant. You keep them on the same things.
Right. I think that is the biggest question. And so most of the time, it's like 30, 30, 30. Like 30% can get worse.
Mhm.
But with that, of making sure that or wanting us to be comfortable with that, with asthma and pregnancy, is that there is a 50% chance when a woman has asthma during pregnancy that her child will develop. And any parent knows that if you ever had a child that had asthma, it can be a scary thing. Okay, especially, if you don't really know much about the disease because you just developed it during pregnancy. So OB-GYNs and, family medicine, internal medicine, like we need to educate the patients because, like I said, if you have asthma, 50% chance your child is going to have asthma.
What 3 tips would you leave us with as far as sex goes? What do you want me to do better? What do you want us to know?
I want couples to slow down. Let's get back into that foreplay. Let's get back into intimacy and paying attention to body language and how we are responding to each other. It says a lot. If you really pay attention to the body, you don't have to talk as much if you just care to pay attention. The second thing that I want women to know and men to know is that you can always use a vaginal lubrication. People tend to think that it's only for menopausal women because when you're in menopause, you have lower estrogen and therefore you have vaginal dryness because the blood supply to your vaginal mucosa is no longer an enjoyable sexual experience. But KY gel or whatever gel you want.
We use olive oil.
Oh, really? Oh, so y'all natural. Okay. Okay, it's probably cheaper too. You know what I mean? You know what I mean?
One of these times you didn't have any
Yeah.
at KY,
I
so
like
you
that.
just
I
like
like
look
that.
it up real quick, and I was like, oh,
Yeah.
okay, cool. So I go downstairs to the kitchen, little olive oil.
Yeah.
You know what I'm saying?
And then-
it lasts.
And then she has to see me in the office because she has a urinary tract infection. So water-based lubricants are always first choice. And I tend to save the oil-based lubricants for my menopausal patients. And they know to urinate right after intercourse. That pulls me into the third tip. Okay, so there's something called honeymoon cystitis, and you don't necessarily have to be on your honeymoon, but that just essentially means that a lot of times, sometimes, sex can be fatigued. You're just exhausted. You might knock out if you did a good job. But you have to remember to get up, go to the bathroom, empty your bladders because women are more prone to getting urinary infections. So empty your bladder. It's okay. You don't have to, you can be 32 and use some vaginal water-based lubrication. It's okay because a lot of times, people don't really pay attention to medications. A lot of symptoms can be traced back to medications. You got to make sure that we ask that. It goes back to the history. And sometimes we're treating and we're going down this rabbit hole and we think we're doing something great when really it was side effect of her birth control, you know? So those are my 3 tips. And remember, all healthcare providers ask about the people's sex life because that is a good marker to how someone is feeling. And as far as my patients go, what I want you guys to learn and understand is you can lie to your ex-husband. You can lie to your friends and family, but don't lie to your doctor. Ask the questions. This is what we're here for. Ask Dr. Kendra.
I'm going to ask Dr. Kendra for one more thing, because I'm going to need me a positive pulse for today. And I've been doing it a lot lately, but Dr. Kendra, I'm leaving it up to you this time.
One that stands out is that I helped a couple who was married for 3 years have sex for the first time. So there is a condition called vaginismus where you have muscle spasms to your perineal muscles, which is the muscles of your pelvic floor. So people can understand if your back is spasmed, if your legs are spasmed, but people just think that down there is altogether different. But you can spasm so bad where it prevents a woman from ever having intercourse. So I had this nice young couple come see me in the office. And again, they've been married for 3 years. And I was taken aback when he and her both said, "Hey, we've never had sex." And I said, "Why is that?" She says, "I just close up. It tenses up. She won't let me in." And first question I ask, "Have you experienced any childhood trauma?" Usually with these kind of stories, you want to make sure you rule out any molestation, previous rape. You definitely have to hit that because then we would want to make sure that person is getting the mental health therapy that they need. On physical exam, she was spasmed, but we can give lidocaine blocks down there to help. I actually prescribed compounding cream that contained Flexeril, which is a common medication used for muscle relaxant that's used for muscle spasms, and I compounded with a benzo. So it's almost like having a wine for your vagina. Just relax. She made improvement along with serial lidocaine that's placed inside the vagina and going to pelvic physical therapy where you work with a PT person who has his expertise in the pelvic floor and you do biofeedback, which a lot of people don't realize that that's when the physical therapist may use vaginal dilators and have you hold. It's like having a coach for Kegels. With that and with her getting therapy, and it was a multidisciplinary approach, they had sex. Did they
report back to you?
Oh, of course. And that's when I kind of wanted to be like a sex therapist where I would want to be, in the room taking notes to see how is she relaxed? How is she responding? So I've never been so happy for someone to have sex. And that is a good man. So ladies, there are good men out there still.
There are very good men out there. I promise you there are. I really want to thank you guys for watching and listening to The Health Exchange. We're on Instagram at The Health Exchange. Get us wherever you get your podcasts every Thursday morning at 6 a.m. Pacific, 9 a.m. Eastern. But first and foremost, Dr. Kendra, where can we find you?
You guys can find me on TikTok, Ask Dr. Kendra, website, also Ask Dr. Kendra, or Instagram, Dr. Kendra MD. I typically respond to questions within a week or two, but definitely thank you for inviting me, and it was a pleasure.
Absolute pleasure. Listen, if you got too much curvature on your penis, Dr. Kendra can help you. If you got vaginal dryness, Dr. Kendra can help.
Right, that's right.
If you got muscle spasms closing up your vagina, Dr. Kendra can help you. And most of all, if you are pregnant and you are having a baby, Dr. Kendra can help you.
That's what's up.
I appreciate it.